Hello, this is MzCAGOMEA, and I'm doing this from the kitchen because it's dark out and it's kind of dark in my room. The kitchen looks kind of dark too, but I'm just gonna work with it. Supposed to be going out tonight. Girls are dragging me out. They say I don't do enough, so I'm gonna go out, do this, and have a good time. So anyway, let's see what I was talking about last time in the other video. Okay, in video 4, we just went over some of the things you might need after surgery and through chemo and everything. So this time I guess I'll talk about chemo. I have seen some videos on YouTube, and I really don't know what chemotherapy they had, where they were all smiling and happy and stuff after they did it, but it was not like that for me. Actually, chemo, to me, all I can describe it as is hell on earth. I went in the first day, had to have 6 rounds of chemo, and I got it done every 3 weeks. And then after I would get chemo, I would get kind of an immune booster, because your white blood cells would drop and everything. So this will kind of help you stay a little healthy. Well, not really healthy, but keep you from getting extra sick or whatever. So I went in the first day to have chemo after I'd had my counseling and everything, and they told me what would happen. And I met everybody in there, and I sat down in a nice cozy recliner, and I didn't get the chemo through my arm. I actually have a port, which you probably can't see. Let me see. You can see the scar. Let's see. You can see it. It's like right up in here. It's just still here. I still have the port. It's right in there. I can feel it right now if I touch it. Well, it's in there. It doesn't hurt. Sometimes it itches. I don't know, because my skin is sensitive. I get a little rash sometimes, but I'll just put some lotion or something up there, and some aloe vera or whatever, and it'll be okay. But anyway, they take the needle and actually push it through your skin into the port that's in your chest, that's connected to one of the larger arteries. If they put it in your vein, it will actually mess your veins up because it's so toxic. Yeah, that's nice. It's a nice word. Toxic. So they will numb you, or you'll have the option of having some cream to cover it for an hour before you go in, and then poke it so it won't hurt. So either way, make sure you can't feel it, because sometimes it's still swollen, because you'll get the port put in there, but you'll still be swollen from the surgery and everything. So, and they still have to do it. So just make sure you're numbed up pretty good, and it won't be a problem most of the time. Sometimes it is a little hard for them to get it in there the first time, so they'll have to try it again, and they'll pull out the syringe to see if there's blood coming up to make sure they got it in just right, so it doesn't just be going where it's not supposed to. So I actually went in the first day, and I was getting 3 different drugs, and they abbreviated them as TAC, and I cannot remember all of them. One was amoxicillin, I think, and anamycin, and something else. I can't remember the C, but at any rate, I didn't like them. And while you were there, you had lots of fluids. You didn't have to stay in your seat. If you had to go to the bathroom, you can get up. They would just unplug you from the wall, and you would still get your medicine while you went to the bathroom. And believe me, you will have to go to the bathroom to pee, because they just pump you up with so many fluids. You'll have to go, and which is a good thing, because they want you to go ahead and empty it from your bladder anyway, so it doesn't mess your bladder up, because it is that toxic or whatever. But I remember they told me that I probably would not get sick until the next day. Maybe that might be true for some people, but it wasn't for me. So I actually got my treatment, and it lasted about 4 hours. I did not drive myself. My daddy drove me there, and I got it, and I went home. And about an hour, 2 hours after I got home, I was sick. I mean, like, I had never been that sick in my life. And while they're doing it, they pump you full of nausea medicine, and they send you home with plenty of it, but sometimes it just does not work. I was just sick, crawling on the floor to the toilet type sick, like barf just shooting out all over the place type sick that night. It was horrible. And it may not be like that for everybody, because there are different types of chemo. But for me, I will tell you, no lies. I'm not going to lie to you. Yeah, it was bad. You'll get stomach cramps, and it's just like a constant feeling that you are going to throw up at any time. So it's like you get your barf bucket and you lay down and try to get in any position that feels good to you, and you just stay there, until the queasiness goes away. I actually found something that does help. One is ginger. I actually got some ginger tea with lemon, and that helps a lot. I drank that before I went in for my treatment. I drank it the night before my treatment, the morning before I went in, and I drank it immediately after I got home after my treatment, and it seemed to help a little bit to calm it, so I wouldn't be like exorcist type, just spewing everywhere like your head spinning around and stuff. That's how it can get. It's bad, and I can say I tried some other stuff too that that they say helps with nausea. I won't say what it was, but let's just say it was recreational, and you could take it from there. And I'll actually say that helped more than anything. It was better than the medicine that they gave me at the doctor's office and everything. It was just, if I get home, barf, and then do that, I wouldn't throw up anymore, And it was great, but I couldn't do it before I barfed the first time, because then it would just queasy, keep you from barfing, and you just be queasy. So, whatever works for you. And I will say, nothing tasted good. Everything was absolutely horrible. My mama made me eat, just because you're supposed to eat so you can live, But everything was just nasty. Meat, I guess that's why I'm a vegetarian now. It wasn't very hard to leave the meat alone. That was just, it tastes like the bottom of your shoe. Like, you just take your shoe and chew on it, and that's what meat tasted like. And mostly, I ate popsicles the whole time I was taking chemotherapy. I ate popsicles like every day, and that actually helped to kind of ease the pain, because when you actually get the shot, it causes flu-like symptoms, and your bones hurt. Your bones hurt a lot. It's like a radiating pain in your bones. It's like can't really do anything. It's like it makes it feel like you want somebody to just take your bones out, massage them, and put them back in. That's what it feels like. But that's what I did. I ate popsicles all the time, and then sometimes I could get up. But I have to say, my body didn't really like chemo anyway. Nobody's body likes chemo. But already the type to tend to get nauseous before, so it was like it just increased it like 10 times worse. So I had to actually, some people would say, oh, I had my treatment and I went back to work. You know what I mean? I'd be in the bed for 2 weeks straight, and then I had one good week, and then it was back for chemo, you know? And it was bad. You have diarrhea, then you get constipated, and it's like back and forth, back and forth, back and forth, and then I have to say, then it will cause you to get hemorrhoids, which are not nice, and then you have to take stool softeners, and you have to drink warm prune juice, and all type of stuff, you know, and it's just one thing will lead to another and another and another, and I was on the phone with the nurse all the time. And I have to tell you, if you have a question, do not be afraid to call your doctor or the nurse that's on staff at the oncology center, because that's what they're there for. You never been through it before. You don't know what to expect. You know, they can tell you what could happen, but until it starts happening to you, and then you don't really know what to do about it. So call them. They don't care. They will answer your call. Leave a message if you have to, and they will call you back. My nurse was really good about calling me back all the time. So, you know, I love her for that. But I don't like warm prune juice. But, yeah, anyway, it was not a pretty thing, and it's something that you have to deal with, and you